In the world of plastic surgery, double eyelid surgery, or Asian blepharoplasty, is to the Asian community what breast augmentation is to Americans. Those who have undergone the procedure have their own reasons for doing it.
I had a little bit of sagging, and I wanted it a little bit just brighter, a little brighter and bigger.
I just have a crease that's set a little bit higher, which lets me put on a bit more makeup if I want to, which I couldn't do before at all. I couldn't even wear mascara.
It's been widely reported that this form of blepharoplasty is by far the #1 plastic surgery procedure performed in Asia. In fact, with the Asian population on the rise in the U.S., cosmetic surgeons like Dr. Charles Lee in Los Angeles have become well known for tailoring procedures to the specific needs of the Asian community.
We are known for in particular, a non-cutting method called the DST.
DST is a durable suture technique that is known as the most sophisticated of the non-cutting methods of double eyelid surgery.
And what's unique about it is that there is a very low breakage rate, even though there's no incisions involved, and it's a suture-based operation. This is a big advance from the older incision techniques. And if you're a good candidate for this procedure, I would highly recommend it.
So, just who is a good candidate for this procedure?
Is someone who has thin upper eyelid skin, doesn't have too much fat, and doesn't have too much sagging of the eyebrow area.
A major benefit to this type of procedure is that the turnaround time for getting back to your life is much quicker than the more traditional method.
You will be able to return to work in a very short period of time, probably about 4 days, as opposed to 1 or 2 weeks that you usually have to wait for when you're doing an incisional type of procedure.
I went in surgery, it was painless, I came out. 3 days later, I continued working and no one really noticed a difference. I got a lot of compliments, but no one even questioned surgery, and that was my main concern.
Whether patients prefer the incisional technique or suture method, the good news to Asians around the world is that now at least there's an option. And though some who have had the procedure have been criticized for, quote, trying to look too Western, this is an eye-opening and welcome option to those looking for a subtle way to enhance their looks.